Hi, I'm Dr. Sandra Cabot and I'm here today with Dr. Marvin Anderson, who's a medical doctor who specialises in autism and internal medicine. And we're talking about a very important subject, and that is how we can reduce the risk of autism and indeed how we can prevent most cases. And this really starts when a woman is planning to conceive. So it's good, to really think about this and really get yourself healthy before you conceive, and then during the pregnancy, and then during the first several years of your child's life. So we're going to look at these factors that anybody can think about and achieve to protect themselves. So it's great to be with you, Dr. Anderson.
Thank you.
Yeah. So let's talk about preconception. What are the most important things that a woman can do to reduce the chance of her child being autistic?
Well, Dr. Cabot, there is a nutrition is critical.
Yes.
And I think first of all we could just take a quick look at what our food supply looks like these days.
Yes.
There are 4 things that are terrible with it. The first thing is that we choose the wrong foods to begin with.
Yeah.
And so that we get what we choose.
Mm.
The second thing is that the food is nutritionally impoverished because
Correct.
it's grown in depleted soil.
Yes.
The
Yes.
third thing is that there are tremendous amounts of petrochemicals and agricultural chemicals that are put onto the soil and work their way into the food supply.
Yes.
And the fourth thing is a little known fact, but there have been filling fertilizer with industrial waste and dumping that on the soil.
Yes.
So this is another source of contamination. So our food supply is terrible. So
Yeah.
using a whole, fresh, pure, nutrient-dense foods, preferably, strongly preferably organic, is a cornerstone.
Yeah.
And if you take a woman that is thinking about becoming pregnant, even before, as you say, before she becomes pregnant, there's a preconditioning that has to come about.
Yes.
And the preconditioning would relate to getting her toxic load, down as much as possible.
Yes.
And then also conditioning her immune system so it's not hyperactive, but it's not underactive.
It's true.
And so avoidance of dangerous substances, at the same time removing the ones that are present, and then giving her some sort of nutritional support. Now, what does that look like?
Yes.
Well, first of all, the essential nutrients are really important. Selenium is important.
Yes.
If it's not present, give selenium methionine.
Yes.
Vitamin D, get sunlight.
Yes.
Vitamin C, in bell peppers and in citrus and in berries. Iodine, vitamin E in avocados. Zinc is important for different chemicals that move metals out. Omega-3 fatty acids are important.
Yes.
And you
Definitely.
can get them in fish oil like Carlson's or
Yes.
Nordic Naturals.
Yes.
You also flax oil, walnuts,
Chia seeds.
Chia seeds.
They're a good source.
Absolutely.
Seeds are a good source.
Seeds are a good source, and
hemp seeds.
Hemp seeds.
Yes.
And iodine is really important,
It is.
And it can be obtained from sea vegetables.
True.
You know?
And a lot of supplements have iodine as well.
Yes.
That's very important. And as you say, condition your immune system and your liver for 6 months, ideally, before you conceive.
And looking at the liver a little bit,
Yes.
it's important to remember 2 things. First of all, the detoxification occurs very well if we eat a lot of cruciferous vegetables.
Yes.
Cabbage, Brussels sprouts,
Yeah, cauliflower, bok choy.
yes,
Yes, kale.
broccoli.
Yeah.
Now these are
smelly.
sulfur-rich compounds, and these environmental toxins leave the body riding out attached to sulfur.
Yes, they
So
do.
then we have to also support that regimen with a good liver supporting herb.
Yes.
And some of the things we think about are silymarin,
Yes.
and taurine,
Yes.
and the components of glutathione.
That's right.
And
Yes.
And also B vitamins.
Yes.
Those are, and acetylcysteine. All
That's
those
right.
things are very important. And then if the woman is in good condition, she'll be healthy. The baby will be healthy, have a much lower incidence not only of autism but of other illnesses like you, I think, mentioned cancer and
Yes.
also allergic diseases. And she can cleanse the baby then even through her breast milk, you know.
Yes, that's right. Well, breastfeeding is wonderful if you can do it. It's good to persist. You know, a lot of women have problems trying to breastfeed, cracked nipples and things like that, and you know, with cesarean sections, the milk doesn't always come in as quickly. And there's a lot of factors, but the key with breastfeeding is to persist. And persist and keep putting the baby on the nipple. And, you know, the breastfeeding is wonderful because it's the highest source of omega-3 fats.
Oh.
Yeah, breast milk is the highest source of omega-3 fats you can find in the world, you know, even higher than fish. So it's wonderful you can do it, but if you can't breastfeed, I think, you know, it's very important to make sure that you're giving the child omega-3 fatty acids in some form, you know, adding it to the formula that they're having in their bottle. And you can get formula foods that are fortified with omega-3. And I think that's very, very important.
You know, there's another factor that we should bring in here, and that's autoimmune disease in the family.
Yes.
You know, what are we talking about? Maybe type 1 diabetes or rheumatoid arthritis or Crohn's or celiac disease, you know?
Definitely.
These things, if they're present in the family, they raise a red flag.
Yes.
And take celiac disease, for an example. The incidence of autism is much higher in celiac patients, and just by avoiding gluten, you know, and also milk too, seems to make a big difference in that. So you want to be careful if you have that sort of history in your family to really be very thoughtful about correcting these abnormalities beforehand.
That's right. I agree. So it's always good to know your family history. Find out, was there autoimmune disease in your parents, your grandparents, your siblings, and if there was, try and avoid gluten during pregnancy and don't give it to the child during the first 12 months of its life particularly. You find gluten in wheat, rye, barley and oats because gluten can really hype up the immune system and cause inflammation in people who have a history of autoimmune disease or a family history.
Yeah, especially inflammation in the brain, and that's that's a big thing. And we ought to be very careful about immunizations in the sense we would be thoughtful about them.
Yes.
There are some individuals that can't tolerate a whole bevy of shots all at one time.
Yes, I agree.
And these individuals, we'll talk about it, should be identified, you know, and the shot should be spread out. The other thing is that we never should immunize a sick child, you know.
True. Yes.
Those are important things to consider.
Yes, if a child has a fever or they've had an upper respiratory tract infection, they shouldn't be immunised until they're completely recovered, and the child should be given vitamin C because that reduces inflammation.
It does, and you know, vitamin A is an antiviral. And given in conjunction with the immunizations, there are drugs that can be taken that will minimize the adverse effects of this. And cod liver oil or vitamin A is one of them, and vitamin C is another. And they should always be taken around the time that the child is immunized.
I agree. You know, preferably for several weeks before the child is immunized. Your vitamin C, your vitamin D, vitamin A, essential fatty acids, and selenium. Because, you know, selenium helps glutathione to protect the cells against free radicals which could be generated in excessive amounts in the brain after a vaccination. So it's prevention really that's the key, isn't it?
You know, it's much easier to do because once that disease starts and the inflammation starts, there is a chemical that pours out in the brain called quinolinic acid, and it causes brain cells to self-destruct.
Yes.
And when that happens, you know, the situation becomes irreversible. The longer we go on with the situation, the more brain cells are lost. So prevention is important, and early intervention is the second.
Yes,
measure.
I agree. And definitely, you know, anyone who's considering having children or who has already had children affected by autism should get Dr. Anderson's excellent book called Autism Prevention, Care and Management. And this is available from Dr. Anderson's website,
which is autism at Abbas Place, ABBAS place.com. That's autism at Abbas Place, no comma, .com.
Great. And also, if you have trouble contacting Dr. Anderson, you can go through liverdoctor.com as well, and we can forward on any emails, because he's only too happy to help. And, the amount of research that is available in this book and the incredible wisdom, practical help is something that really every parent needs. So thanks a lot, Dr. Anderson.
You're welcome.
Being with us today.
Thank you, Dr. Cabral.